Hi, Assalamualaikum student. So this is the topic of SSD, pharmaceutical dosage form in terms of the semi-solid preparation. So basically, in this topic and video, you can focus more in terms of the introductions on SSD. Second, type of the SSD. First is the cream. We will identify some of the ingredients, type of the emulsifying agent. Second, ointment. For the ointment, most importantly, we focus in the base in terms of the base. Okay, and then the third is the paste and gel. Basically, SSD is a medication in between solid or liquid. So they usually used to be applied to the skin, nasal mucosa, cornea, rectal or vagina tissue. Semi-solid dosage form like gel, cream, lotion, and ointment are useful for topical delivery of nanocrystal. So just for the information, the nanocrystal-based topical formulation, it may contain stabilizer, gelling agent, emulsifying agent, preservative, antioxidant, and humectant. Semi-solid dosage form comprise a body of the products which, when applied to the skin or accessible mucus, tend to alleviate or treat a pathological condition or other protection against harmful environment. About the anatomy of the skin. Skin is the largest organ of the body. The main functions of the skin is about protection. It protects the body from external factors such as bacteria, chemicals, and temperature. It comprises three layers. The first one is the epidermis, the outermost layer, also called as the stratum corneum. Second is the dermis. It contains blood vessel, nerve, fiber, sweat gland, and hair follicles. And the last one contains hypodermis or subcutaneous fat. So basically, if any of the drugs that require to reach the site of the disease in order to act, the drug it must either pass through the stratum corneum here or go through the follicle or the sweat glands. Once the medication arrive at the skins, if a lipid soluble drugs or lipophilic medication, they tend to accumulate in the lipid region. While for the hydrophilics, the water soluble drugs, they tend to enter the blood capillary and be removed from the skin. That's about the ideal properties of the semi-solid form. Ideally, it can be divided into three criteria or properties. The first one is the physical properties, second psychological, and the third one is the molecular properties. Ideally, a semi-solid dosage form has a smooth texture without any grittiness. It will be non-dehydrating, non-hygroscopic, non-staining, and non-greasy. Although not all SSD forms meet all of these criteria. For example, ointment, they are both greasy and staining. Second, because of these drugs are applied to the skin, they shouldn't cause any irritation, sensitization, do not alter the membrane function, miscible with the skin secretion. And the last one, application properties. Once applied, it must be easily to be applied with the efficiency of the drug release to the target or to the site of the action and have high aqueous washability. Basically, the release characteristic of an SSD forms, it can be depend on a few different factors. For example, including the size of the particles in the dispersed phase, the flow characteristic of the medication, and the interfacial tension between the continuous and dispersed phase. So basically, for the classifications of SSD, you can classify them into 5 groups: creams, lotion, paste, ointment, and gel. First, creams, they are also designed for the topical use. They are similar to ointment but typically have an opaque appearance and a higher water content and less oil. This makes cream less greasy than ointment and easier to be sprayed over large area of the skin. Cream can be water in oil or oil in water. Second, lotion. They are similar to creams but have an even higher water content, making them the lightest of the SSD. Some of the lotion, they might also contain alcohol. Third, paste. Paste have a thicker consistency than ointment, as they are a mixture of the powder and ointment. They may be designed for the topical and transdermal use. They can be difficult to apply evenly and to the large area. As such, pastes are most often used to treat the localized condition, for example, athlete foot. Fourth, gel. Gel are semi-solid dosage form that can be either topical or transdermal. They are aqueous colloidal suspension with a liquid phase that is entrapped in polymer matrix. Gel tend to be clear or translucent, and their smooth consistency makes them easy to be applied evenly over a large area of the skin. In addition to being used as a medication, gel also can be used as the lubricant. So as mentioned before, creams, it can be divided into water in all cream in form of the oily cream, and it usually contain lipophilic emulsifying agent. Usually it being used as the emollient or as cleansing agent. Second, for the all-in-water cream, that's usually in form of an aqueous creams, it's contain all-in-water emulsifying agent. All-in-water creams usually one of an elegant of the drug delivery system. So when all and water are mixed powerfully, they form either all in water or water in all emulsion. In all in water emulsion, all is dispersed in a continuous water phase, while in water in all emulsion, water droplets are dispersed in the all phase. So continue from the previous slides about the emulsifying agent. When choosing an emulsifying agent, it's important to consider the specific requirement of your cream formulation, whether you want to prepare all in water or water in all cream, such as the desired texture, stability, and shelf life also need to be considered. Additionally, some of the emulsifying agent may have specific application or limitation, so it's essential to ensure compatibility with the other ingredients in your formulation as well. Basically, emulsifying agent can be divided into three main types. The first one, synthetic emulsifying agent, which is the first anionic. So anionic, these include substance like SLS, stand for sodium lauryl sulfate, which have a negatively charged hydrophilic. It's a water attracting portion. Second, cationic surfactant, for example, is the acetyl trimethyl ammonia bromide. They have a positively charged hydrophilic portion. The third one is the non-ionic surfactant, for example, polysorbate 80. Non-ionic surfactant, they do not carry a charge and are often used for their gentle and stable properties. So basically, for the non-ionic surfactant, it's a neutral charge. And then for the semi-synthetic emulsifying agent, there's two, which is polysaccharide, such as acacia and tragacan. And then second, they also have the natural products. For the semi-synthetic, they often use in the food and pharmaceutical industry. The third one, sterol containing substance, which is the emulsifying agent used in prepare water in all cream. So the first one is the beeswax. It contains ester that can function as emulsifier in water in all emulsions. Second is the wool fat, also known as the lanolin. It's a natural substance from the sheep wool that can have emulsifying properties. The third one is the wool alcohol that are often used as co-emulsifiers or stabilizers in the emulsion. Continuing from the previous slides, a wide range of material can be used as the surfactant, and selection is made in the view of the type of emulsion required. For example, in prepare and aqueous cream, you can use the list of these emulsifying agent, or this type of the emulsifier. In preparing an oily cream, this is an example of the emulsifying agent that can be used. We are still in the context of the preparing or formulations of a cream. Previously, in the previous three slides, we learned about the choosing the emulsifying agent. While in this slide, apart from the emulsifying agent or active pharmaceutical ingredient, we also need to choose the vehicles to prepare a cream. So vehicles can be divided into three types of the vehicles: water miscible vehicles. These include water, alcohol, and microgold. The second one is the oily vehicles, for example, light liquid paraffin, mineral oil, or petrolatum. The last one is the vegetable oil, for example, such as silicone oil. That's of cream preparations. So the possibility of microbial contaminations of cream during preparation must be minimized, since they provide suitable substrates for the growth of microorganisms which may cause spoilage or pathogenicity. Microbiological contamination refer to the non-intent or accidental introductions of infectious material like bacteria, yeast, mold, fungi, virus, prions, protozoa, or their toxin and byproducts. So few of the practice can be applied to ensure microbial safety to prepare a cream. The first one, strict hygiene and aseptic technique while preparing a cream in your lab practical. Second, as a minimum, all apparatus must be thoroughly cleaned before use and rinsed with freshly boiled and cool purified water before trying. You will come across and see the freshly boiled and cool purified water in the lab later. And then the operator or personnel must maintain the highest standard of the hygiene. From the cream to the second SSD, which is ointment. Ointment are semi-solid preparations of a drug substance dissolved or dispersed in a semi-solid ointment base made of a paraffin or other hydrocarbons. They are usually homogeneous, translucent, and viscous. They can be medicated or not medicated, means maybe contain API or not contain API. It's usually have a greasy preparation compared to the cream. The base usually anhydrous and immiscible with the skin secretion. Third, it can be used as the emollient, a fat on the skin. And then lastly, it may contain a surfactant to allow to be washed off easily, since oil and water are immiscible. From the previous slides, ointment. The base is the most important ingredient used in the formulation of ointment SSD. Typical ointment base comprise of petrolatum and mineral oil or petrolatum and WC or fatty alcohol combination. The ratio and grades of these components being selected to give the desired finished product viscosity or spreadability. Ointment bases usually do not merely act as the carrier of the medication but also control the extent of absorptions of medication incorporated with them. Choosing the base. The ideal properties of a base for an ointment, it should be physically and chemically stable. In ointment base, finely divided active ingredients should be uniformly distributed. The base of ointment should not possess any therapeutic action. The ointment also should be smooth and free from grittiness. It also must not retard wound healing, have a low sensitization index, pharmaceutically elegant in term of the physical appearance. Next, release the medication efficiently at the site of application, have low index of irritation, non-dehydrating, non-greasy, and neutral in reaction. And it must have compatible with common medication and also with the skins. It must be easily washable with the water, have minimum number of the ingredient, and easy to be compound and remain stable on storage. To choose the base to be used in the formulation, 6 factors can be used. 7 factors can be considered. The first one, the desired release rate of the drug substance from the ointment base. Second, desirability of topical or percutaneous drug absorption. The third one, desirability of occlusions of moisture from the skin. Fourth, stability of the drug in the ointment base. Fifth, effect, if there's any, of the drugs on the consistency or other features of the ointment base. Sixth, desirability for easy removal of the base by washing with water. 7, characteristic of the surface to which it is being applied. So vehicle or carrier of an ointment is known as an ointment base. The choice of ointment base depends upon the nature of the medication, the stability of ointment, clinical indication of ointment, and some of the factors that we've discussed in the previous slides. So basically, base can be categorized into four groups: hydrocarbon base, absorption base, water miscible base, and water soluble base. For the hydrocarbon base, they are immiscible with water and not absorbed by the skin, almost inert, and absorb very little water from the formulation or from the skin. Most of the hydrocarbon base, they have the properties to inhibit water loss from the skin. Okay, so they will form a waterproof film, and may encourage absorptions of the medication longer through the skin. For example, if you use soft paraffin, hard paraffin, liquid paraffin, paraffin ointment, and others. Second, absorption base. Um, at any example of the absorption base, it will absorb water and aqueous solution to produce water in all emulsion. Examples such as wool fat and wool alcohol or beeswax. Third is the water miscible bases. Ointment made from water miscible base are easily to be removed after being used or applied on the skin. For example, emulsifying ointment BP, cetrimide emulsifying ointment, or cetomicrogol emulsifying ointment. The last one is the water soluble bases such as macrogol or polyethylene glycol PEG. This is the third form of the SSD, which is paste. Paste are vehicles, whether in the aqueous or oily phase. It have a high concentrations of added solid, large amount of finely powdered solid, usually around 50% or more. For the paste, due to the finely powdered solid, um, this ingredient makes them thick or stiff. So paste usually do not spread and so localized drug delivery. For example, like toothpaste. Paste is SSD, same as before for the external application. It may contain one or more API. They are usually principally used as the antiseptic, protective, or soothing dressing, which are often sprayed on lint before being applied. So the last form of the SSD is the gel or jelly. So gel and jelly have the gelling agents such as gelatin, example tragacan, gelatinized starch, or cellulose derivative. They are usually in the aqueous gel. They can be used as the lubrication or being applied a drug to the skin. The gel, transparent or translucent, they are non-greasy and usually being used as the aqueous preparation. In terms of the application, it can be used as the lubricant for the catheter and examination during the ultrasound.